Okay, hello and good evening and welcome to this conversation. So invite someone, tag someone, and also please tell me if my sound is good. Previously I had a bit of a challenge. So can one of you just tell me, give me a signal that the sound is good? Okay, if you tell me the sound is good, then I'm good to start. Good evening, good evening. Is my sound okay? Okay, excellent. Sound is okay, very good. Now, first of all, I hope you had a very productive day. Today was a holiday. It was a National Day of Prayer. So today what I'm going to do is that I'll speak for just a few minutes and then I'll let you ask questions. The reason I'm raising this topic is because a number of you, both inbox and otherwise, have been asking me questions that relate to douching. Now, some of you may not be aware what douching is, especially if you are a man and you're on this program, you may not know what douching is. I'll explain what that is. But at the same time, I thought that instead of just addressing douching as a topic, let's discuss the vaginal tract of the vagina in general as a topic, so that those that may not be in the know or those that may not be aware, maybe some things are done purely because we have not explained. Maybe it's because there's a mismatch in knowledge about, this very important organ. The entire universe of human beings depends on this very organ for propagation of our species and for our own survival. Now, there's a way in which this particular organ is structured that a lot of people are not aware of. So I'm going to start by explaining, first of all, the normal structure of this particular organ, and also how it functions. So that when you begin to observe certain things, you need to be able to know, when should I go and see a doctor? What is considered abnormal and what is considered normal? Because some of the things that you see or you observe may actually be okay, and it's actually normal for those things that you're observing. But because no one has told you that it's normal, you panic and you start doing things that actually end up making things worse. So, if you've just joined this conversation, tonight we are discussing vaginal well-being and types of discharge. Now, let's begin. So, the vagina is a sexual organ which is only found in females. Unless you are an intersex person, you may have a vagina and male organs as well. But generally speaking, is that this is an organ that is found in females. It is a tube which has muscles around it. So it's a tube which is made of muscles. And inside this tube, it has a lining. And the lining that is inside the vagina is the same lining that you have in your mouth, whether male or female. Same lining. It also has glands inside. It has glands that secrete fluids. You also have glands on the cervix that secrete fluids. There's also something very important in the vaginal tract that is extremely, extremely important, is that it has bacteria and fungus living together in a delicate balance. Okay? Let me repeat that. The vagina is a tube made out of muscle. Inside the tube, it has a lining like a carpet, the way you put carpet in the house, or the way you put wall tiles in your toilet. It has a carpet covering the entire tract. And the lining of that tract is exactly the same lining that you have in your mouth, whether male or female. In addition to that, it has glands which secrete fluids. In addition to the fluids, the glands that secrete fluids, both in the vaginal wall and the cervix, it has bacteria and fungus that live in there in a delicate balance. Now, these fluids that the vaginal tract and the cervix produce, they do a very important function. The function of those fluids is to sweep out, clean out dead cells and unwanted material that may be there. Okay, so it does its own cleaning. It produces its own fluid, which does the cleaning. Now, in addition to that, it has what we call in medical language normal flora. What is normal flora? This is bacteria and fungus which is supposed to be there. Now, that bacteria and fungus which is supposed to be there, its job is to create an environment such that that environment is hostile to any other type of bacteria other than itself. So it maintains the pH and it keeps the space clean. If you disturb the balance of the bacteria and fungus, which normally lives there, you end up with problems that I will explain. If you disturb that normal flora, you end up with problems that I will explain later on. That is why we keep insisting as doctors that the vagina does not need your help to maintain its well-being or to maintain itself or to keep itself clean. It doesn't. So those things you keep inserting, I've heard all kinds of things that you ladies are doing to yourselves. I'm told some of you insert cloves. You get cloves, you soak them in water, and you take that water and you at flashing or douching. Some of you have even heard that you douche with steam. You call it vaginal steaming. For what? Who told you? Who out there taught you that the vagina needs your assistance? It does not. Okay? It doesn't. And I will explain. As I have explained, because this particular organ is already created in a manner that it can take care of itself, much like your eye. You know, your eye produces a lot of fluid, and every time you blink, it's cleaning itself. Okay? Have you ever tried to clean your eye with soap, the way you people do with this very important organ? You flash soap in there, you flash all kinds of things in there. Stop it. Actually, you think you are helping, you are actually destroying. You are destroying the normal environment, and that environment is needed. Now, some may argue, Doc, how come there are all these odors that we smell, banji. There are all these issues that we have. Listen, one of you asked me and said, Doc, but what is, in fact, this came from a man who asked me to say, look, but there's this bad odor that comes every time we meet. I said, you see, that can be managed. You don't need to start douching to manage that. You don't. How you manage that, for example, as a lady, you know that you're about to meet with your man. You know that he's given enough signals that you're about to meet. You know, excuse yourself, go in the shower, take a quick shower and come back. You will notice a big difference. Huge difference. The only reason sometimes, in fact, majority of the time, of course, there are other times, majority of the time you get bad odor from that organ, it is down to poor personal hygiene. Usually. Poor personal hygiene, also wearing inappropriate underwear, where you wear very tight clothes, you know, and you wear fabrics that are not breathable. All right? And also you find that sometimes if a woman is using a wrong technique for wiping, especially you go to the bathroom to pee and you're using a wrong technique for wiping, you know you're supposed to wipe from front to the back. But some of you don't know. You wipe from the back to the front, and therefore you end up bringing dirt from the anal region all the way up to the vaginal area, and as a result you end up with a bad smell. So now, if you know these techniques, you know how to wipe. That you know that when you're in the bathroom and you're wiping as a woman, it's front to back, not back to front. For some of you, this information may sound obvious, but for your friends, no one has ever told them how to wipe. Okay? No one has ever told them how to wipe, and as a result, it has created a problem. Second, some of your friends, some of you, it may be obvious, to others, it may not be that obvious. No one has ever told your friends that when you're about to meet with a man and you took a bath in the morning or a long time ago, okay, you're about to have, adult relations with a man. It's important that if you know that you took a bath some time back, go and take a shower and clean yourself with just water. On the outside even, not putting water inside and flushing things with water and things. That's not what we are saying. Just bath. Clean yourself up nicely, not even just ordinary water. Take a bath and you will be fine. You will come back to me and say, Doc, I tried what you said and there's no complaint. The smell has gone. So, personal hygiene is adequate. Are there times that you have discharges that are not okay? Yes. But then what is considered a normal discharge? You see, as a woman, maybe some of your friends may not know, you go through different types of discharge depending on where you are in your cycle. Or sometimes depending on whether you're pregnant or not. Sometimes depending on whether you're breastfeeding or not. That normal discharge, you will find that if you are breastfeeding, it increases in amount. If you are sexually aroused, it increases in amount. If you are pregnant, it also increases in amount. Okay, you know that. And it has a certain characteristic. In most cases, it doesn't have a bad odor per se. Well, it may smell, but it doesn't have a bad or offensive odor. Usually, you know that if it has a bad or offensive odor, it's usually down to personal hygiene. And in terms of color, depending, you'll find that if you're ovulating, your normal discharge, it becomes like egg white, like this, and it's light when you're about to ovulate. After that, it's a bit cloudy, okay? It's white and it's cloudy, and it's normal. It's white and it's cloudy, and it's okay. All right? So you don't require to start douching, to start steaming, to start inserting things, okay? Especially these things you like inserting. Let me also talk about this issue of vaginal tightening. I honestly don't understand that. Okay? There are people who sell you these things. I've seen these things that you insert that you will be tight within 15 seconds or 30 seconds or 10 minutes. I don't know. But I've seen it. It's like a tampon like this. And people tell you those things. No, you'll be tightened. You will tighten within a few minutes. Insert this. Now, let me ask you. If you've used those products, ask yourself, just check. How long does the tightness last? How long? So don't deceive yourselves. Okay? That muscle, and I'm also addressing men here. The vaginal tract, because it's a tubular muscle, it can stretch. How do you think the baby comes out? Because that muscle can stretch, which also brings me to the issue of enlargements that people like to do here. To what extent are you going to enlarge? If that muscle can stretch to even accommodate a baby, the head of a baby, is that how far you want to go with enlarging yourself as a man? Really? Because no matter how much you enlarge, that muscle, that tube, the vaginal tract, can stretch and accommodate you. It can. So, this pursuit for enlargement and tightening and all that, the problem is in your mind. The actual organs themselves have no problem. If you know what you're doing, But that's a discussion for another day. Now, when you are observing these discharges, and I've told you that some of the discharge, most of the time that you see is actually normal. And if you have been observing yourself as a woman, you know that this discharge is okay. When your period has started, you know the colors that you go through until they stop. When you're between your periods, you know the discharges that come, that this type of discharge is okay. It's usually when you're ovulating, it's like egg whites. When you are not ovulating, it's cloudy, like white, but cloudy. Okay. And ideally, it should not give out bad odor. Like it should not give out offensive odor. When there's an offensive odor, you know that in most cases, it's hygiene or this issue of, wearing very tight underwear and fabrics that are unfriendly to the organ. Now, when should you worry as a woman and what should you do? Okay, because the people who are selling these douching methods, go and douche this, go and do steaming and whatever, the language has been that go and douche for you to take care of bad odor. And I'm saying we're against that. Okay, now what should concern you about bad odor? And I'll discuss that so that you're also aware of what you should be doing. Because it's not enough to condemn something without telling you what you should be doing. Okay? When should you be concerned? Okay? So, as a woman, here's when you should be concerned. For example, if you notice that you are having a bloody discharge in between your periods, you know that your periods ended, and you know that you're not even supposed to be bleeding at that time, but you're having a bloody discharge, then you need to worry. Or you're having a bloody discharge after intercourse, then you need to worry. It's something you need to go and see your doctor over. Okay? And also, for example, you're a woman and you finished menopause like more than a year ago. You had menopause more than a year ago and you've never had periods in between, but suddenly you're starting to see a bloody discharge, then you need to go and see your doctor. That's something to worry about. Okay? Now, the other thing that should concern you is the color of the discharge. Remember, I've told you that normal discharge, if you're ovulating, it's a bit like, egg white. And if you're not ovulating, it's white. The amount can increase depending if you're breastfeeding or you're sexually aroused or you are pregnant, it can increase and it's normal. Don't worry, don't panic. Don't start douching because of that. Okay? Now, if the discharge has changed in color, say for example, it's pink or red, I've told you, then there's a problem there. You need to go and see your doctor. But there are other colors that should be of concern to you. For example, the discharge has changed color to gray. Okay? It is gray and it's foul smelling and it's itching. That type of discharge is called bacterial vaginosis. And you don't sort that out with douching and steaming and going to put all kinds of things there, vinegar, acid, all those things you like putting. You don't sort out bacterial vaginosis with that. Okay? Bacterial vaginosis, the way you fix it is that you know that if you have bacterial vaginosis, which presents with a grayish smell, a grayish colored discharge, very foul smelling. It smells like fish or rotten fish. Usually you see this in women who have multiple sexual partners. It's very common. When we see that, we even know it even as doctors, that this one has multiple sexual partners. The way you fix it is that you need to go and give the patient antibiotics for some time, and it goes away with antibiotic treatment. It doesn't go away with the douching or putting steam in the vaginal tract. Okay? That's not what solves the problem. You actually make it worse with your douching. The other color that should be of concern to you is when the color of the discharge changes from yellow, goes to yellow, like deep yellow, and also becoming greenish, still foul smelling. That's usually a bacterial infection, either gonorrhea or one of those. Okay? And that one, it's also itching When you see that one, don't believe anyone who tells you, go and steam, or go and put acid, or go and put vinegar, or go and put a soapy water, go and put soap with scents. No, go and see your doctor. If you see a discharge which is yellowish, almost green, and it's foul smelling and itchy, don't feel shy. Go and see your doctor, and they'll fix it for you. Okay. There's another type of discharge. It's almost frothy. It's frothy like mafakamanzia soap or man's soap. Frothy like that. That's another issue that you need to see your doctor. It's whitish, frothy, like soapy water. That type of discharge, you need to see your doctor. Don't do douching. Don't go and put things in there to make things worse for yourself. That's why you end up with all kinds of cancers. Now, let's discuss this douching thing. Now, if you're a man and you're hearing me talk about douching, you're probably wondering, what is douching? Now, to douche is to soak something, either in water, to immerse, that's to douche, either to soak something in water or whatever. Now, some of these ladies, what they do is that they think that doing a bubble bath with the scented soaps and whatever will maintain the scentedness in the vaginal tract. It doesn't. All that douching you do doesn't. What douching does, here's what it achieves. It will give you a momentary sense of, for a moment you will feel like you are clean and you've solved the problem. What you've actually succeeded in doing, remember I talked about in the beginning that the vagina has a balance of bacteria and fungus. When you're doing this steaming that you do and the douching that you do, either with vinegar, some of you with lemon, some of you with acid, some of you with clove, some of you with steam, what that does is that it actually kills the normal bacteria. It disturbs the balance of the bacteria and fungus in the vaginal tract. When you disturb that balance, what ends up happening is that you are now open to sexually transmitted diseases. You are now open to pelvic inflammatory disease. That is why you end up with pelvic inflammatory disease even when you didn't have sex with anyone. Why? Because you've disturbed the balance. Now, what pelvic inflammatory disease does is that if it is not properly treated or properly identified, these are women who come later on in life, they can't even have children. Why? Because the tubes are blocked. And then you forget that you're doing douching. Happily doing douching. You forget. Now you are married, the husband wants children, you can't have children because you forget you're doing douching, and because of that you had pelvic inflammatory disease and your tubes got blocked and you can't have children anymore. Have you seen the order of events? Have you seen the risk that you're taking? Now the question you should ask yourself, as a woman listening to this, is the risk worth it? This douching you like doing, and these things like inserting and disturbing the normal flora. The vagina is not broken. There's a very important saying. If it is not broken, don't fix it. Why are you fixing something that is working perfectly? It doesn't need your help. Who told you that it's broken, that it needs fixing? Who has been telling you that it is broken? It's not broken. And I have told you when you should be worried. Is there an itch? Has the discharge changed in color? Is there a bad odor? Okay? Is there blood? And is the blood coming when it's not supposed to come? Then go and see your doctor. Stop doing these douching things. Stop. Because you're taking a big risk. Huge risk. Okay? And later on, you fail having children, you start having problems bearing children, then you start, complaining, and you forget that you were excited about douching. No professional out there worth their salt will promote douching. There is no professional out there with their sort who encourage you to disturb the balance in the vagina by inserting things. You insert this, you insert that, including steam, acid, vinegar, whatever else you like putting in there. There is no professional out there who's with their sort who knows and understands that organ will encourage you to do those kinds of things. Kulibe. And therefore, I personally do not understand why you women do this to yourselves. I'm told it's even a business for some people. They're actually making money off you. They are risking your life, and you are willingly even paying them to risk your life. Ladies and gentlemen, I know majority of you here are ladies. Fine. Let me take questions before I finish. Let's see if you have questions for me or comments. Johnny, ask. Ask. What of steaming, doc? Is it safe? We've said this. Do not steam because it doesn't help you and it is not helpful. All you're going to succeed in doing is disturb the normal environment. That's normal environment I talked about. It's very delicate. And going forward, there's a way in which you must manage yourself. I discussed that. There's a way you can manage, because sometimes, yes, there may be bad odor, and bad odor could be because, remember, you were working the whole day. You last took a bath in the morning, and it's late in the evening. You will have bad odor coming from there, because look, you've been sweating, you've been all these things. Just take a shower and you'll be fine. No need to steam. No need. Okay? And this steaming that you do, these people, they don't even tell you how to do it safely. What if you get burnt? Huh? You burn the entire thing. What's going to happen? So don't do steaming. I don't encourage it. Next question. Next question. Okay, can a man be put on treatment to prevent transmission of PID? Yes. For example, if you as a woman, you were diagnosed with PID, then your man must also be treated. And that's how PID is managed. You have to do contact tracing and treat the man as well. Yeah. Next question. Okay. At Doc, what about cranberry juice? Don't put juices anywhere. We don't want you to put a juice there. Next question. Okay, I'll take this one. No. There's a question I've missed here. What is that question? It was a very important question. Namisa question is very important. Yeah, let me look for it. Where is that question? There's someone who asked a very important question. Okay, fine. I'll replace it with this one. I'll look for it. So, what causes a pinkish discharge? Okay, so a pinkish discharge is because of bleeding. You could have, commonly you could have cervical cancer, you could have cervicitis, you could have injured yourself during sexual intercourse, and you have tears in the vagina, and you may have a pinkish discharge. So a pinkish discharge is basically telling you that there's a bit of bleeding that's going on, and it's mixed with a normal discharge. Okay, and so it's got a color pink. So they will think about vaginitis or cervical or cervicitis or cervical cancer in worst case scenarios, or just trauma like you had dry sex and you had cuts or tears in the vagina and you may end up with a pinkish discharge. But don't ignore a pinkish discharge. If you have a pinkish discharge, don't ignore it. See your doctor. There's a question that I skipped. I hope I'll find it. It was quite important that we answer that particular one. Well, okay, I'll answer that question indirectly with using this question. So the question here is, what is PID? But the other question that was asked was, what are the symptoms of PID? So very quickly, PID, or rather pelvic inflammatory disease. This is an infection of the uterus, the tubes, and the ovaries together at the same time. Either all of them at the same time or parts of it, but basically it's an infection that has gone up inside and it has affected the uterus, the tubes, and the ovaries. And usually it's bacterial infection, usually. In most cases, it is usually gonorrhea or chlamydia, in most cases. And in most cases, it is a sexually transmitted disease. Either you yourself, you have multiple sexual partners, or your partner, the one you had sex with, has multiple sexual partners. Or you were doing douching. Douching is a risk factor for pelvic inflammatory disease. Because now when you do douching, either steaming or you've put something in there, you've now disturbed the environment. Now you've left yourself open and vulnerable to infection. So you end up with pelvic inflammatory disease. Now, what are the symptoms? Because that's the other question someone asked me. Doctor, what are the symptoms of pelvic inflammatory disease? The symptoms, first of all, it's pain in the lower abdomen. And the pain is such that it's just below your belly button and above your hip. In that area, that's where the pain would be. And you may have a fever, okay? You may also have a discharge, a very abnormal discharge. And those are the symptoms. Treatment, antibiotics. Another thing that may predispose you to, or that may disturb the protection. Remember that the normal balance of those, of the bacteria and fungus in the vaginal tract, that normal balance can also be disturbed by abuse of steroids. For example, if you're a lady and you're using a steroid-based product to bleach your skin, you are also disturbing the balance in the vaginal tract. And as a result, you will end up having very foul odor. You may not smell it yourself, but the people around you are smelling it. You may cover it with a lot of perfume, but remember that because you're using a steroid-based chemical to bleach your skin, what that happens is that because you're using a steroid-based, steroids have gone into your blood and they've disturbed the vaginal tract balance. And that's how you end up with the same result as douching, where you are open to infection. You end up with PID, you end up with a foul-smelling discharge. You may not feel it yourself, you may not smell it, but the people around you are probably getting it. You can cover it with perfumes, but then look, just stop abusing steroids and you'll be fine. Because that's another thing that we don't discuss much. This thing where you have bleached your skin so badly and you're using a steroid-based bleach, okay? And it has also destroyed that balance in there, because that can also happen. Next question. Okay, we should be taking our last question and almost going away now. Okay, what causes yeast infection? How frequent is normal yeast infection in women, and who is not pregnant? Okay, fine. So here's the issue. You will notice, ladies, that when it comes to the yeast overgrowth in the vagina, sometimes it can be because you actually do have an infection. Sometimes you've noticed that around your periods, just after your periods, you have an increase in the production of a whitish, thick, fungal infection of some kind, but that one is self-limiting. It actually stops on its own. But now this question is asking, what happens if the infection has established itself? Usually fungal infections in the vagina are usually because, for example, if you have diabetes and it's not very well controlled, you end up with that yeast infection. Or you have anything that has disturbed your immune system. Either it's HIV, or you are on chemotherapy, or you're on steroids for a very long time. It can affect that and you end up with a yeast infection. Sometimes these same things that you like doing, the douching you like doing, inserting things and disturbing the balance, you end up with dominance of the fungal infection. But otherwise, this yeast infection can be controlled. Okay, if you find that it was just because you've just come out of the period because of the hormonal imbalance, because that hormonal imbalance just after the periods can also induce the yeast to overgrow. And if it's not stopping on its own, see your doctor. They will give you something to control it and you'll be fine. Generally speaking, the yeast infection is not a sexually transmitted disease. So it's not listed as an STD or as an STI. But understand that the same yeast infection that you have can also affect the man. You can easily affect the man with the yeast infection, and he may experience cuts, around his manhood. And he may also experience a bit of a rash. In men, it's called balanitis. Yeah, it can be self-limiting. Okay, we don't necessarily usually have to treat it, but if it requires treatment, it's also just give them antifungals, and it goes away quite easily. So with yeast infection, for the men who are listening to this, if you see that she has a yeast infection, it's not an STD, because men get confused. That's the problem. It's not an STD. Okay, and it can be controlled. Can be controlled. Right. I think here's what you're going to do, ladies and gentlemen. Share this video as widely as you can, because we need as many people as possible to know this. And if you need reminding, we can come back in future and discuss this all over again. But share this video as much as you can. You can download it if you want and upload it on your pages, whatever you like to put it. I don't mind. We need empowered communities, empowered women out there who are able to make informed decisions. Because there are people out there also unscrupulous who are taking advantage of your lack of information to make money. And while they're making money, they're destroying your health and they're destroying you. Now, we can't stand idly by and watch them do that. Okay? And watch them do that. No, we can't do that. We can't. And we will not. So, share this video. And if you know a friend who has been douching or encouraging you to douche, let them watch this video. If they are in doubt, they can also contact us. It's very easy for us to explain these things to them. But at the same time, for you who has understood this, if you're not able to share the video, share the information. Sit down with your friends and share the information and explain the very things we've just explained tonight. Thanks for listening and thanks for staying with us. All right. Someone is saying there are many questions. I have not seen them. Okay. If there'll be more questions on this subject, I can easily come back later on in the next few weeks to address the issues that you may have. Okay. All right then. Good night. Enjoy the rest of the evening and take care.